Under normal conditions of use, SIMV modes may behave in one of 5 possible scenarios. 3 of them are associated with a high set rate, and the remaining 2 with a low set rate. At a high set rate, SIMV modes act very similar to CMV modes. If the patient is passive, all breaths are VTMB. If the patient is partially active, there may be a mixture of VTMB and PTMB. If the patient is active, all breaths are PTMB. At a low set rate, the interval is long so that SB can take place between 2 consecutive PTMB. The SB may be pressure supported or unsupported. In these cases, SIMV modes act like pressure support mode. Typically, SIMV modes have the following controls: rate, TI or I to E ratio, patient trigger type and sensitivity, tidal volume per volume SIMV, pressure control for pressure SIMV or target volume for adaptive SIMV, pressure ramp or rise time for pressure SIMV and adaptive SIMV, flow cycle ETS, PEEP, FiO2. Volume SIMV mode may have 2 more controls: flow pattern, inspiratory pause. Support modes. This group has 2 modes, pressure support mode and volume support mode. Each has just one breath type, pressure SB for pressure support mode, and adaptive SB for volume support mode. In support modes, there is no backup rate. The ventilator delivers a spontaneous breath immediately after a valid patient trigger is detected. Otherwise, it keeps waiting. Therefore, support modes are indicated for active patients only. Always enable apnea backup function in a support mode for patient safety. Pressure support mode. This mode is also known as SPOND, PS or PSV. We use SPOND thereafter. SPOND mode is widely used, and is the most comfortable for active patients among all traditional modes. Pressure support, P support, is a critical control in this mode. By setting it, you define the level of ventilator support for patient breaths. If P support is set reasonably high, SB are adequately supported. In this way, pressure support mode suits active patients who cannot yet do all of the required work of breathing. If P support is set to 0 or close to 0, the patient breathes spontaneously at PEEP, with no or little machine support. This suits the active patients who have stable and strong breathing activities. Such an application is typically used for weaning. Volume support mode. The volume support mode is derived from the pressure support mode, and is relatively young. Its clinical benefits and limitations are not yet fully known. Target volume is a critical control of volume support mode. The ventilator automatically regulates the inspiratory pressure after every breath to match the monitor tidal volume to the set target volume. You need to adjust the setting of target volume to meet the patient's ventilatory demand, which may change over time. Failure to do so can lead to unwanted hyperventilation or hypoventilation. The volume support mode has just one possible scenario. Typically, support modes have the following controls: patient trigger, type and sensitivity, P support for pressure support mode or target volume, V target, for volume support mode, pressure ramp, P ramp, flow cycle ETS, PEEP, FiO2. Biphasic mechanism and modes. Biphasic modes are the third mode category. Before talking about biphasic modes, we need to learn biphasic mechanism. Mechanical breaths, the basis of IPPV, can be generated in 2 ways: classical mechanism or biphasic mechanism. Classical mechanism. The classical mechanism was described in the module Ventilator System Concept. In short, during inspiration, a ventilator opens the inspiratory valve and closes the expiratory valve, causing the airway pressure to rise. During expiration, it closes the inspiratory valve and opens the expiratory valve, causing the airway pressure to drop. As such, the two valves always act in opposite ways. However, this mechanism cannot generate PEEP. A special PEEP generating mechanism must be added. During late expiration, the desired PEEP is generated by the interaction between the declining expiratory flow, delivery of a constant base flow, and regulation of the expiratory valve for an appropriate level of resistance. This mechanism is sometimes called active exhalation valve. Biphasic mechanism. The biphasic mechanism is an extension of the PEEP generating mechanism. You can find PEEP control in all ventilation modes. Let us do an exercise. Set PEEP to 5 centimeters of water. Wait for 4 seconds. Increase PEEP to 20 centimeters of water. Wait for 2 seconds. Repeat the above steps sequentially. The activities cause the PEEP to alternate between 5 and 20 centimeters of water in a specific time pattern. The resulting waveform is very similar to that of a pressure mode. This proves that mechanical breaths can also be generated by PEEP generating mechanism. For this application, PEEP alteration is called biphasic mechanism. In biphasic modes, PEEP alternation is automated. For that we need 4 special controls: PEEP high, PEEP low, PEEP high time, PEEP low time. Initially, the biphasic mechanism was applied to non-invasive ventilators. There, the PEEP high and PEEP low are sometimes called inspiratory positive airway pressure, IPAP, and expiratory positive airway pressure, EPAP. The major advantage of the biphasic mechanism, at least in theory, is better patient comfort and synchrony because the ventilated patients can breathe or even cough anytime at either PEEP level. This is not possible with the classic mechanism because the expiratory valve closes during inspiration. However, with biphasic mechanism, a ventilator consumes much more gas than the classical mechanism for the same application. By definition, PEEP counts from 0 or atmospheric pressure. This also applies to PEEP high and PEEP low. In a pressure mode, however, the inspiratory pressure, that is, P control or P support, counts from PEEP. Therefore, in a pressure mode, the peak pressure is the sum of P insp and PEEP, while in a biphasic mode, the peak pressure equals PEEP high. If you are not sure how inspiratory pressure in pressure modes and biphasic modes is defined in your ventilator, ask the manufacturer. 2 applications of the biphasic mechanism. Biphasic mechanism is mainly applied in mimicking traditional pressure and adaptive modes and forming unique biphasic modes. Duo PAP and APRV are 2 typical biphasic modes. The 2 modes may be merged into one.